My name is Nicole Klaus. I'm an RN with 6 years' experience in a psychiatric hospital. We will later be joined by Nicole Wenstrom, CNA, who has 12 years' experience in home health care and in a psychiatric hospital. The following lesson will teach you the SAFE model, influence on client feelings, what we can do to prevent problem behaviors, and we'll finally discuss signs of problem behaviors such as depression and suicide, agitation, and wandering and confusion, and how we can best help those clients who are experiencing these behaviors. We're going to look at the SAFE model. The SAFE model stands for Staff Actions Equal Fewer Escalations. The model stands for all of the influences on our feelings and our clients' feelings impact our behavior while they impact our patient's behavior. And then our behavior impacts patient behavior while patient behavior impacts our behavior. If we have effective interventions, we can possibly reduce acting out behavior, while if we don't have effective interventions, we may have acting out episodes. Behaviors are verbal or nonverbal actions by staff or clients. Feelings are internal emotions of ourselves and of our patients. Behaviors or actions are symptoms of feeling, and it's very important to always remember what feelings are behind the behavior. Some of the influences on feelings that can cause acting out behaviors include medical conditions such as pain, medication, urinary tract infection, and constipation. Confusion, losses such as privacy, body function, freedom, family and friends, stress, time of day, sundowns, weekends, sometimes nighttime can be a difficult time for patients. A break in routine can be a difficult time for patients. If patients are used to a certain event occurring at a specific time of day and we change that, that may cause a change in their behavior. The environment has a big impact on behavior. Staff, peers, the building setup, their surroundings, all of those different things can impact their behavior. Noise level is another thing in the environment that can impact a patient's behavior negatively. And now we'll go to Nicole Wenstrom, who will talk about communication, professionalism, and self-care.
When communicating with clients, the first thing you need to do is consider special challenges the clients may have. Ask yourself, does the patient have a hearing impairment? Are they easily confused? Next, take note of your environment or your surroundings. Specifically note noise levels. To reduce environmental noise, turn down TVs, radios, and electronic equipment before beginning your cares. If the patient is in a common area which is loud or chaotic, move the patient to a more quiet environment before beginning to communicate with them. There are two basic types of communication that we want to take a look at today. One is nonverbal and the other is verbal. When communicating with a patient, introduce yourself and let the patient know how you will be assisting them. Speak clearly, avoid mumbling, and give good eye contact. If a patient is confused, try to use shorter sentences and slow your pace. Avoid communicating and asking the patient questions while your back is turned to them. Speak directly to the patient and communicate what you are doing at all times. In addition, we need to be conscious of our nonverbal communication techniques, facial expressions, body language, and work pace. Always greet your patient with a smile. Avoid scowling or rolling your eyes. Be aware of hand placement and body language. If a patient is becoming anxious while giving cares, slow your work pace. This shows the patient that you are aware of their feelings and can help put the patient at ease. Another part of providing quality care is being a professional. We must always realize that our feelings and behaviors influence the feelings and behaviors of our clients and coworkers. Remain calm and consistent. Communicate. Use appropriate verbal and nonverbal communication techniques. Use your team. Utilize team members as resources. Incorporate good patient care ideas from your team members into your daily routine. And understand your client. Know and understand the patient and any special needs that they may have. Lastly, we need to take a look at taking care of ourselves. Be aware of nonverbal behavior. Be aware of verbal behavior. Take a breath. Take a moment to organize your tasks in order to help you manage your day better. Talk with team members and debrief. Talk or debrief with your coworkers away from patient care areas. Communicate challenges, ask for help, and support your coworkers. Finally, take your breaks. Now we'll go back to Nicole Klaus, who will discuss problem behaviors.
Now we'll take a look at some of the specific problem behaviors. The first one that we'll look at is depression and suicide. People that are high risk for this include white males over the age of 65 who live alone, anyone over the age of 75, people with a recent diagnosis of a terminal illness, including cancer, people suffering from recent loss of a spouse. Some of the signs and symptoms you may see are frequent crying, agitation, someone who stays alone when they usually participated in a lot of things with other people. You may see a change in eating and a change in weight. You may see someone gain a lot of weight, or you may see someone suddenly lose a lot of weight. Inactivity, especially when you have someone who is outgoing. And you may see changes in sleep patterns. Somebody may suddenly start sleeping a lot, or somebody may stop sleeping. One of the other symptoms that you may see with depression and suicide is a sudden improvement in mood. This is a very dangerous sign and symptom, and when you see this, it must be reported to your supervisor immediately.